1. What is the primary nursing action for a patient with a blood glucose level of 50 milligrams per deciliter? Answer. Administer fast-acting carbohydrates. Explanation. Administering fast-acting carbohydrates, like juice, raises blood glucose quickly in hypoglycemia, a critical intervention to prevent neurological harm and ensure patient safety. 2. Which hormone is deficient in a patient with type 1 diabetes mellitus? Answer. Insulin. Explanation. Type 1 diabetes results from insulin deficiency due to pancreatic beta cell destruction, guiding insulin therapy to manage blood glucose and ensure metabolic stability. 3. What is the primary symptom of hyperthyroidism? Answer. Weight loss. Explanation. Weight loss, due to increased metabolism and hyperthyroidism, guides thyroid function assessments and interventions to stabilize endocrine health and patient well-being. 4. What is the priority nursing action for a patient with suspected adrenal crisis? Answer. Administer hydrocortisone. Explanation. Administering hydrocortisone replaces cortisol in adrenal crisis, a critical intervention to prevent shock and ensure patient safety in endocrine emergencies. 5. Which gland regulates calcium levels in the blood? Answer. Parathyroid gland. Explanation. The parathyroid gland secretes parathyroid hormone to regulate calcium, critical for assessing bone and neurological health in endocrine disorder management. 6. What is the primary patient education topic for a patient newly diagnosed with diabetes? Answer. Blood glucose monitoring. Explanation. Teaching blood glucose monitoring empowers patients to manage diabetes, a critical step to prevent complications and ensure long-term endocrine health. 7. Which laboratory test confirms hypothyroidism? Answer. Elevated thyroid-stimulating hormone. Explanation. Elevated thyroid-stimulating hormone indicates reduced thyroid hormone production, guiding diagnosis and treatment to restore endocrine balance and patient stability. 8. What is the primary nursing intervention for a patient with diabetic ketoacidosis? Answer. Administer intravenous insulin. Explanation. Intravenous insulin lowers blood glucose and halts ketone production in diabetic ketoacidosis, a critical intervention to reverse acidosis and ensure patient safety. 9. Which hormone is oversecreted in Cushing syndrome? Answer. Cortisol. Explanation. Excess cortisol in Cushing syndrome causes symptoms like weight gain, guiding endocrine assessments and interventions to manage metabolic complications. 10. What is the primary symptom of hypoglycemia in a diabetic patient? Answer. Shakiness. Explanation. Shakiness, a neurological response to low blood glucose, signals hypoglycemia, guiding rapid carbohydrate administration to prevent seizures and ensure patient safety. 11. Which gland is responsible for growth hormone secretion? Answer. Pituitary gland. Explanation. The pituitary gland secretes growth hormone, critical for assessing developmental disorders and guiding endocrine treatment in clinical practice. 12. What is the primary nursing action for a patient with a blood glucose level of 400 milligrams per deciliter? Answer. Administer insulin as prescribed. Explanation. Administering insulin lowers dangerously high blood glucose, a critical intervention to prevent hyperglycemia complications like ketoacidosis in endocrine care. 13. What is the primary symptom of Addison's disease? Answer. Fatigue. Explanation. Fatigue, due to cortisol deficiency in Addison's disease, guides endocrine assessments and hormone replacement to restore energy and ensure patient stability. 14. Which medication is commonly used to treat hyperthyroidism? Answer. Methimazole. Explanation. Methimazole inhibits thyroid hormone synthesis, a critical treatment to manage hyperthyroidism symptoms and ensure endocrine balance in patient care. 15. What is the primary patient education focus for a patient with hypothyroidism? Answer. Medication adherence. Explanation. Teaching medication adherence ensures consistent levothyroxine use in hypothyroidism, a critical step to maintain thyroid function and prevent endocrine complications. 16. Which hormone is deficient in diabetes insipidus? Answer. Antidiuretic hormone. Explanation. Antidiuretic hormone deficiency causes excessive urination and diabetes insipidus, guiding desmopressin therapy to restore fluid balance and ensure patient safety. 17. What is the primary nursing intervention for a patient with hyperosmolar hyperglycemic state? Answer: administer intravenous fluids. Explanation: intravenous fluids correct dehydration in hyperosmolar hyperglycemic state, a critical intervention to stabilize endocrine function and prevent organ failure. 18. Which laboratory test confirms hyperthyroidism? Answer: decreased thyroid-stimulating hormone. Explanation: decreased thyroid-stimulating hormone with elevated thyroid hormones confirms hyperthyroidism, guiding treatment to normalize endocrine function and patient health. 19. What is the primary symptom of a patient with acromegaly? Answer: enlarged hands and feet. Explanation: enlarged hands and feet, due to excess growth hormone in acromegaly, guide pituitary assessments and interventions to manage endocrine complications. 20. What is the priority nursing action for a patient with suspected thyroid storm? Answer: administer beta blockers. Explanation: beta blockers control heart rate and symptoms in thyroid storm, a critical intervention to prevent cardiovascular collapse and ensure patient safety in endocrine emergencies. 21. Which gland regulates blood glucose through glucagon secretion? Answer: pancreas. Explanation: the pancreas secretes glucagon to raise blood glucose, critical for assessing metabolic control in endocrine disorders like diabetes. 22. What is the primary patient education topic for a patient with adrenal insufficiency? Answer: stress dose steroids. Explanation: teaching stress dose steroids prepares patients with adrenal insufficiency for crises, a critical step to prevent shock and ensure endocrine safety. 23. Which hormone is oversecreted in pheochromocytoma? Answer: catecholamines. Explanation: excess catecholamines in pheochromocytoma cause hypertension, guiding endocrine assessments and interventions to manage cardiovascular risks. 24. What is the primary nursing intervention for a patient with hypoglycemia unawareness? Answer: teach frequent glucose monitoring. Explanation: teaching frequent glucose monitoring prevents undetected hypoglycemia, a critical intervention to ensure patient safety and endocrine stability. 25. Which laboratory test monitors long-term blood glucose control in diabetes? Answer: hemoglobin A1C. Explanation: hemoglobin A1C reflects average blood glucose over months, guiding diabetes management to prevent endocrine complications and ensure patient health. 26. What is the primary symptom of hyperparathyroidism? Answer: bone pain. Explanation: bone pain, due to elevated calcium in hyperparathyroidism, guides parathyroid assessments and interventions to manage skeletal and endocrine health. 27. What is the primary nursing action for a patient with a blood glucose level of 30 mg per deciliter? Answer: administer glucagon if unresponsive. Explanation: administering glucagon raises blood glucose in unresponsive hypoglycemic patients, a critical intervention to restore consciousness and ensure patient safety. 28. Which hormone is deficient in hypothyroidism? Answer: thyroid hormone. Explanation: thyroid hormone deficiency causes hypothyroidism symptoms like fatigue, guiding levothyroxine therapy to restore endocrine function and patient energy. 29. What is the primary patient education focus for a patient with type 2 diabetes? Answer: lifestyle modifications. Explanation: teaching lifestyle modifications like diet and exercise improves blood glucose control in type 2 diabetes, a critical step to prevent endocrine complications. 30. Which gland is responsible for aldosterone secretion? Answer: adrenal gland. Explanation: the adrenal gland secretes aldosterone to regulate sodium and blood pressure, critical for assessing fluid balance in endocrine disorder management. 31. What is the primary nursing intervention for a patient with suspected myxedema coma? Answer: administer levothyroxine. Explanation: administering levothyroxine reverses severe hypothyroidism in myxedema coma, a critical intervention to restore metabolic function and ensure patient safety. 32. Which hormone is oversecreted in hyperaldosteronism? Answer: aldosterone. Explanation: excess aldosterone causes hypertension and hypokalemia, guiding endocrine assessments and interventions to manage fluid and electrolyte balance. 33. What is the primary symptom of diabetic neuropathy? Answer: numbness in extremities. Explanation: numbness in extremities, due to nerve damage in diabetic neuropathy, guides neurological assessments and interventions to prevent injury and ensure safety. 34. What is the primary nursing action for a patient with a blood glucose level of 600 milligrams per deciliter? Answer: notify the healthcare provider. Explanation: notifying the healthcare provider ensures rapid intervention for severe hyperglycemia, a critical step to prevent ketoacidosis and ensure patient safety. 35. Which laboratory test confirms diabetes insipidus? Answer: elevated serum osmolality. Explanation: elevated serum osmolality with dilute urine confirms diabetes insipidus, guiding desmopressin therapy to restore fluid balance and ensure patient health. 36. What is the primary patient education topic for a patient with hyperthyroidism? Answer: avoid stimulants. Explanation: teaching patients to avoid stimulants like caffeine reduces hyperthyroidism symptoms, a critical step to ensure endocrine stability and patient comfort. 37. Which hormone is deficient in hypoparathyroidism? Answer: parathyroid hormone. Explanation: parathyroid hormone deficiency causes hypocalcemia in hypoparathyroidism, guiding calcium supplementation to prevent neurological complications. 38. What is the primary nursing intervention for a patient with suspected diabetic foot ulcer? Answer: perform wound care. Explanation: performing wound care prevents infection in diabetic foot ulcers, a critical intervention to promote healing and ensure patient safety in endocrine care. 39. Which gland regulates metabolism through thyroid hormone secretion? Answer: thyroid gland. Explanation: the thyroid gland secretes thyroid hormone to regulate metabolism, critical for assessing energy levels in endocrine disorder management. 40. What is the primary symptom of a patient with pituitary adenoma? Answer: vision changes. Explanation: vision changes due to pituitary adenoma pressure on the optic chiasm, guide endocrine assessments and interventions to manage neurological complications. 41. What is the primary nursing action for a patient with suspected hyperosmolar hyperglycemic state? Answer: administer intravenous fluids. Explanation: intravenous fluids correct dehydration in hyperosmolar hyperglycemic state, a critical intervention to stabilize endocrine function and prevent organ failure. 42. Which hormone is oversecreted in prolactinoma? Answer: prolactin. Explanation: excess prolactin in prolactinoma causes symptoms like galactorrhea, guiding endocrine assessments and interventions to manage pituitary function. 43. What is the primary patient education focus for a patient with Cushing syndrome? Answer: monitor for infection. Explanation: teaching infection monitoring reduces risks in Cushing syndrome due to immunosuppression, a critical step to ensure endocrine patient safety. 44. Which laboratory test monitors thyroid function in hypothyroidism treatment? Answer: thyroid-stimulating hormone. Explanation: thyroid-stimulating hormone levels guide levothyroxine dosing in hypothyroidism, ensuring optimal thyroid function and patient endocrine health. 45. What is the primary nursing intervention for a patient with suspected thyroid cancer? Answer: prepare for surgical consultation. Explanation: preparing for surgical consultation facilitates thyroidectomy planning in thyroid cancer, a critical step to ensure timely endocrine treatment and patient safety. 46. Which hormone is deficient in type 2 diabetes mellitus? Answer: insulin sensitivity. Explanation: reduced insulin sensitivity, not absolute deficiency, characterizes type 2 diabetes, guiding lifestyle and medication interventions to manage endocrine health. 47. What is the primary symptom of hypocalcemia in a patient with hypoparathyroidism? Answer: muscle cramps. Explanation: muscle cramps, due to low calcium in hypoparathyroidism, guide neurological assessments, and calcium supplementation to ensure patient safety. 48. What is the primary nursing action for a patient with a blood glucose level of 250 milligrams per deciliter before a meal? Answer: administer insulin as prescribed. Explanation: administering insulin lowers elevated pre-meal blood glucose, a critical intervention to prevent hyperglycemia complications in endocrine care. 49. Which gland is responsible for epinephrine secretion? Answer: adrenal gland. Explanation: the adrenal gland secretes epinephrine to regulate stress responses, critical for assessing cardiovascular function in endocrine disorder management. 50. What is the primary patient education topic for a patient with diabetes insipidus? Answer: fluid intake monitoring. Explanation: teaching fluid intake monitoring prevents dehydration in diabetes insipidus, a critical step to maintain fluid balance and ensure endocrine patient safety.